Did you know that ignoring the signs of a mini-stroke could lead to a life-changing or even life-threatening stroke within just 90 days? These warning signs are often subtle and easy to miss, especially in the elderly. But here's the truth. Recognizing these early signals could be the difference between life and irreversible damage. In today's video, I'm going to share the 10 critical signs of a mini-stroke so you can take action fast and potentially save a life, whether it's yours, a loved one's, or even someone around you. A mini-stroke, medically known as a transient ischemic attack, TIA, is a critical health event that occurs when there is a temporary interruption of blood flow to the brain, often caused by a small clot or plaque buildup in the blood vessels. Although the symptoms of a TIA resolve quickly, typically within minutes or hours, this temporary relief can lead to a dangerous misconception that the problem has passed. In reality, a TIA serves as an urgent warning sign of an impending major stroke. The elderly, particularly those over 60, and those with pre-existing health conditions like hypertension, diabetes, and pancreatic issues, are at an increased risk of experiencing a TIA. Chronic pancreatitis and blood sugar imbalances, for example, can exacerbate the risk by promoting inflammation and metabolic disturbances, which weaken blood vessels and contribute to plaque buildup in arteries. This process heightens the chances of a clot breaking off and traveling to the brain, causing a major stroke. Alarming statistics from the American Stroke Association indicate that up to 20% of individuals who experience a TIA will suffer a major stroke within the next 3 months, emphasizing the importance of swift action following a mini-stroke. Ignoring the signs of a TIA can lead to irreversible damage, long-term disability, or even death. The connection between pancreatic health and the risk of TIAs highlights the importance of managing underlying conditions like diabetes, inflammation, and high cholesterol to reduce stroke risk. By controlling blood sugar, cholesterol, and inflammation, individuals can significantly lower their chances of experiencing a TIA or a full stroke. Immediate response after a TIA is essential for preventing further damage. Recognizing the symptoms and seeking medical attention can save lives, making awareness and early intervention critical in managing this potentially life-threatening condition. Understanding these risks and signs can empower individuals, especially those with metabolic issues or elderly individuals, to take preventive measures and seek medical care before a larger, irreversible stroke occurs. This knowledge could be the difference between life and death, underscoring the necessity of staying alert to early warning signs and acting quickly to protect brain health. Number 1. Sudden weakness in the face, arm, or leg, especially on one side. One of the most common symptoms of a mini-stroke is sudden weakness or numbness in the face, arm, or leg, particularly on one side of the body. You might notice someone struggling to lift an arm, smile evenly, or grip objects. This occurs because blood flow to the part of the brain controlling movement is temporarily disrupted. To identify this symptom quickly, use the FACE-T method. F. Face drooping. Ask them to smile. Does one side droop? A. Arm weakness. Ask them to lift both arms. Does one drift downward? S. Speech difficulty. Are they slurring words or unable to speak clearly? T. Time to call emergency services. Act fast and seek medical help immediately. According to the American Stroke Association, quick action can prevent serious brain damage. Number 2. Sudden confusion or trouble speaking. If someone suddenly becomes confused, struggles to find the right words, or speaks incoherently, this is a major red flag. TIAs often impact the speech centers of the brain, causing slurred speech or difficulty understanding conversations. A study published in the Journal of Neurology highlights that speech disruptions occur in nearly 25% of TIA cases. If a loved one suddenly says things that don't make sense or stops mid-sentence, it's time to take action. Number 3. Blurry vision or loss of vision in one or both eyes. A sudden loss of vision, blurriness, or seeing double can signal a mini-stroke. This happens when blood flow to the optic nerves or visual processing centers in the brain is temporarily blocked. Some describe it as feeling like a curtain is falling over one eye, or that their vision goes black for a few moments. Dr. Mary L. Johnson, a stroke specialist, explains, "Visual symptoms during a TIA are often mistaken for eye strain or fatigue, but they should never be ignored, especially in the elderly." Number 4. Dizziness or loss of balance. Sudden dizziness, trouble walking, or feeling like the room is spinning are common but overlooked symptoms of a mini-stroke, especially in older adults. Many elderly individuals attribute these sensations to aging, fatigue, or dehydration, but they can indicate reduced blood flow to areas of the brain responsible for balance and coordination. If someone suddenly stumbles, loses their balance, or feels unsteady without explanation, consider it a warning sign. Number 5. Severe sudden headache. While headaches are common, a TIA-related headache is typically sudden, sharp, and intense. It can appear out of nowhere and feel unlike a regular headache or migraine. Neurologist Dr. Stephen Larson explains, "A headache during a mini-stroke often feels explosive and debilitating. Unlike migraines, there's no aura or gradual onset. It's sudden and severe." Number 6. Numbness or tingling. Sudden numbness, tingling, or a pins and needles sensation can occur during a mini-stroke, particularly in the face, arms, or legs. This happens when blood flow to the brain disrupts nerve signals to these areas. For example, an elderly person may suddenly drop an object because their hand feels numb, or they may notice half their face feels tingly. While these symptoms might disappear quickly, they are clear indicators of a TIA. Number 7. Short-term memory loss. Confusion, forgetfulness, or temporary memory lapses are common during a mini-stroke. Blood flow interruptions can affect the brain's ability to form and retrieve memories, which can be particularly concerning in elderly individuals. If a loved one suddenly forgets where they are, what they were doing, or seems disoriented, it could signal a mini-stroke. This is especially true for individuals with diabetes or pancreatic problems, as these conditions can already impact cognitive function. Number 8. Sudden trouble. Understanding others. During a TIA, blood flow to the brain's language centers may be disrupted, making it difficult to understand spoken words or follow conversations. If your loved one suddenly seems confused, stares blankly when spoken to, or struggles to respond appropriately, take it seriously. For example, you might ask a question like, "Would you like some water?" and receive no response or a completely unrelated answer. These are often clear indicators of a problem. Number 9. Difficulty swallowing. Difficulty swallowing, also known as dysphagia, can occur when a mini-stroke affects the part of the brain controlling motor functions in the throat. This symptom is more common in the elderly and is often overlooked as a normal part of aging. If someone suddenly struggles to swallow food or drinks, coughs excessively during meals, or complains of throat discomfort, it could be due to a TIA. Immediate medical attention is necessary to prevent further complications. Number 10. Temporary loss of consciousness. Brief fainting spells, blackouts, or sudden exhaustion can occur during a mini-stroke, as blood flow to critical areas of the brain is momentarily disrupted. This is often mistaken for low blood sugar, dehydration, or fatigue, especially in elderly individuals with underlying conditions like diabetes or pancreatic problems. Research shows that TIAs can cause syncope, brief blackouts, in older adults, making it essential to consider this a warning sign. If someone faints or becomes unusually drowsy without explanation, seek medical help immediately. Each of these 10 signs is your body's way of alerting you to a potential problem. Mini strokes are serious, even if the symptoms disappear quickly. Ignoring them could lead to devastating consequences, including a major stroke. If you notice any of these symptoms in yourself or a loved one, act fast. Time is of the essence. What to do if you notice these signs? If you notice any signs of a mini stroke, acting immediately is critical to prevent a major stroke that could result in permanent disability or even death. A transient ischemic attack, TIA, might seem minor because its symptoms are temporary, but it's a serious warning sign that requires urgent action. The first step is to call emergency services immediately. Don't wait for the symptoms to resolve on their own. Use the FAST method to identify key symptoms: face drooping, arm weakness, speech difficulty, and remember, it's time to call for help. While waiting for medical professionals, keep the person calm and lying in a comfortable position, preferably with their head slightly elevated to encourage proper blood flow to the brain. Note the time the symptoms began, as this information helps doctors determine the best treatment course. Avoid giving the person food, water, or medication because swallowing may be impaired during a TIA, increasing the risk of choking, and administering medicine without medical advice can make matters worse. At the hospital, doctors will perform tests such as MRI or CT scans to check for brain damage, carotid artery examinations to look for blockages, and blood tests to identify issues like high cholesterol, blood sugar imbalances, or clotting problems. Once a TIA is confirmed, doctors typically prescribe antiplatelet medications like aspirin or anticoagulants to reduce clotting risk. Preventive measures also focus on lifestyle changes to avoid future strokes, including a balanced diet with fruits, vegetables, whole grains, and healthy fats, along with regular exercise to boost heart and vascular health. For individuals with pancreatic issues, controlling blood sugar is particularly vital, as diabetes and insulin resistance significantly increase stroke risk. Managing blood pressure and cholesterol through both diet and medication, if necessary, further reduces the chance of a major stroke. By acting fast and following these medical and lifestyle recommendations, you can significantly decrease the risk of further complications. Remember, a mini stroke is the body's alarm system, giving you the opportunity to make life-saving changes before a more severe stroke occurs. Take these signs seriously and prioritize early intervention. You just might save a life. Mini strokes, or TIAs, are not minor events. They are critical warning signs of something much more severe. Recognizing these symptoms, such as sudden weakness, confusion, dizziness, vision loss, or slurred speech, can be life-saving, especially for the elderly or those dealing with underlying health conditions like diabetes or pancreatic issues. Ignoring these signs could lead to a major stroke, which may cause permanent disability or even death. If you notice any of these symptoms, don't wait. Remember, time lost is brain lost. Act fast, call emergency services immediately, and make sure the person gets the medical attention they need. These moments of quick action can truly make the difference between recovery and tragedy. Your knowledge is powerful. Share this video with your friends, family, and anyone you know who may be at risk. You never know whose life you might save. If you found this video informative, don't forget to like, subscribe, and hit the notification bell so you won't miss our next video on important health topics. Let us know in the comments if you or a loved one has experienced a mini-stroke, or share any tips you use to stay healthy. For more videos on health, stroke prevention, and improving overall well-being, check out our other content. Together, let's keep spreading awareness and helping each other live healthier, safer lives. Thank you for watching, and see you in the next video.